I am Richard August, your host for this first edition of State of the State since the hiatus caused by the COVID-19 pandemic. Our guest is candidate for governor, Luis Daniel Munoz. Welcome back to State of the State.
Thank you so much for having me.
Dr. Munoz, this is not, as they say, your first rodeo. You were an independent candidate for governor back in 2018, and you appeared on this program in March of that year. This time around, you're running in a crowded field of Democrats. Why did you change from an independent to a Democrat?
Yeah, I mean, to answer that question, I think it's important to rehash some of the history that went into my making that decision. I grew up in Central Falls, went through the public school system, worked really hard, and with the support of the community, ended up becoming a medical doctor. That personal professional journey gave me a lot of perspective. And when I looked at politics in Rhode Island and asked the question, why aren't we seeing programmatic change? It always ended up coming down to one answer. We have political operatives that game the system, that focus on political dealing, insider deals, rather than focusing on working families in the state. And so you might say it's a bit of a rage against the machine at the time, but I ran as an independent really to go against an establishment that was not working for the people. What I've realized since 2018, going through the COVID-19 journey, supporting the community on the Rhode Island State Equity Council as well as professionally, is that if we really want to transform the way politics are done in Rhode Island, then we have to address the Goliath. And that Goliath is the Democratic establishment. And that's why I'm running in the Democratic primary.
So last time around, you got 6,223 votes, which was 1.7% of the total cast. You were 2,000 votes ahead of the cannabis candidate, Ann Armstrong, who came in last. What makes you think you'll succeed this time around?
Yeah, well, look, there's a clear data point there. I can't refute the data. What I can say is things happened in 2018 that contributed to that data. One, to be transparent, is fundraising is obviously very difficult when you're an independent, because in Rhode Island, the history of independents are the Joe Trillos. And so coming out with more policies focused on social programmatic changes that support people, lifting them out of poverty, doesn't align with the traditional independent in Rhode Island, and half the time you spend just explaining that you're not that. So time is consumed doing that. It's difficult to fundraise. But in addition to all of that, I was also excluded from the major debates while Joe Trillo, while Bill Gilbert were allowed in. And when you're not on the debate stage, it's a disservice to voters, because the assumption that voters make is that you have left the race. And so that final number was certainly impacted by those factors.
So you believe in the primary you can beat Dan McKee, who's the incumbent governor, and other Democrats with better name recognition like Secretary of State Nellie Gorbea, Providence Mayor Jorge Elorza, and probably General Treasurer Seth Magaziner. How do you overcome that name recognition gap?
I doubt that they're the only candidates. This is likely going to be a six-way race. Who knows if even more than a six-way split. Historically in Rhode Island, when there are crowded fields, surprises happen. And those surprises in this case can be to the advantage of Rhode Island's working families. All of those candidates have name recognition, but they also have a track record of inaction, a track record of not taking bold steps, of not demonstrating political courage to push back against special interests like insurance companies that are overcharging healthcare insurance premiums. So do I believe I have a chance towards victory in this Democratic primary? The answer is yes. Do things need to happen to ensure that I get there? Absolutely. We need to fundraise sufficiently to break the threshold and enter into the debates. We need to empower disenfranchised communities to turn out the vote. But make no mistake, 50,000 votes will win this primary. I'm hoping it's 100,000, but it's feasible.
In April, when you announced, you said, and I quote, "We know we need to reach a threshold to inform Rhode Islanders about our message." What is that threshold in your opinion, and how much money have you raised since your announcement?
Yeah, so in terms of fundraising, momentum has started to pick up now. So it's really after the third quarter that we'll likely show momentum. In terms of threshold, what I was specifically talking about was this arbitrary metric that we establish in Rhode Island to allow candidates to enter into debates, meaning that we have major media outlets that host the debates. And historically, they have had requirements that you have like 5% within a poll that's done by an independent party, which is sourced by the media outlet. And then on top of that, that you've raised a certain amount of money. Past years, it's been 250,000. We're hoping that doesn't change strategically this year. That's to get on the debate stage. And the important thing to recognize is all the work goes into all the work goes in before the debate, right? So I shook 60,000 hands before any of the debates took place last time. Not being on the debate stage countered all that work. And so between now and the debates, expecting that we will break that threshold and get into the debates, the work is really going into communities, canvassing, and frankly, independent of door knocking, actually supporting the communities in the work that's taking place. We have a homeless encampment addressing the challenge of homelessness in Providence, and no one was going to the encampment to address the need for additional resources. I was there. We had a vaccine equity gap in this state with racialized communities being at higher risk for hospitalization and death, and yet the resources were not being pulled into getting the vaccine. I was there working alongside community leaders to bring vaccination clinics. It's not just about campaigning, though the saying goes, campaigning is one thing, governing is another. It is actually about showing how we will govern. And in a crowded race, everyone's going to be forced to do that.
Now, both Elorza and Gorbea are Latinxers, for lack of a better term, and Governor McKee seems to be joined at the hip by his hand-picked Lieutenant Governor, Sabina Matos. It seems like the Latinx vote is going to be spread pretty thin. Are you counting on overwhelming support from that community?
No community is monolithic. No community. And so what's important to recognize is we have a history in Rhode Island of well over 50% of voters not consistently voting. And the question is why? Because again, cronyism and establishment politics has governed the state of Rhode Island for decades. My belief is that the base of this people-powered campaign is a base of mindset. And the mindset is, how do we create solutions? How do we leverage the resources in a way that's both fiscally responsible, but also reflects our humanity, which is addressing homelessness, addressing the need for food assistance, addressing environmental justice, not only addressing climate change, but also the asthma rates that have resulted from higher rates of pollution near the port areas and the families impacted, which are racialized communities of color, but also communities that are our Caucasian neighbors that are also entrapped in cycles of poverty. As you said, you went through Central Falls through high school. You went to Rick, majored in philosophy, did some medical research type work, and then went back and did your pre-med studies. You went to the University of Connecticut School of Medicine, earned your MD degree. Then you went to Japan and you were doing surgery in what you described as an alternative system of medicine. What did you mean by that? I'm talking about the interview you did 4 years ago. What do you mean by an alternative system of medicine? How is the Japanese system different than ours, and why is it better? Well, they have a single payer system, and it is different. And I would say, when I say different, I'm going to try to really consolidate something very complex into 60 seconds here. So I'm happy to have a longer
Take 5
discussion.
minutes.
But single payer systems vary in their form in different countries. And so the idea is, how do we best control cost? And what we know in any business is the more hands that touch a dollar, the less of that dollar you'll get in the end. So how do you remove all the intermediary steps and players involved with getting a dollar from the bank through a billing system, through an intermediary party, through a service provider, right up to the physician, right? And the reason that we want to consolidate that and make it more direct in terms of where that dollar goes and making sure it gets to the patient, to the physician, is all of those intermediary steps aren't just taking from that dollar. They're actually adding to the total cost. So they're taking, but all that taking little by little is actually resulting in the patient paying more money at the counter or at the pharmacy counter or when they get their bill, right, for healthcare. So when we think about single payer systems, the idea is, how can the government take more control over the administration of those funds to ensure that there is less abuse by intermediary businesses that are trying to take portions of profit and contributing to the total cost of care? That's one facet of single payer. Now, the more complex side of it, this part B, if you will, is the delivery system. And this is where it varies between countries, whether you're looking at Sweden, Japan, Israel. Every country has a different healthcare system when I say healthcare system, a different way that doctors work within that payment system to get care to patients. They have different policies, different practices. In Japan, it's a 70-30 split. The government pays 70% of total cost, manages the distribution of those payments directly, and then 30% the patient covers, which is very low. And the patient can actually get supplemental private insurance, which at times even gives the patient ability to get more money back than they actually pay. Now, Japan is a homogeneous population relative to the United States of America. And what we've seen, if you compare Japan or any country to another, is the prevalence of chronic diseases like diabetes and heart disease are different. Higher in one country, lower in another. In the United States, we have a very high prevalence of chronic diseases, which is a consequence of lifestyle choices, facet of things, environmental issues for certain communities, right? That chronic disease being at higher rates in the US creates more cost burden. So when we look at single payer systems in Japan and we see the great things that can happen, or Israel, and we see how we can control drug prices, how we can take more control of how that dollar gets from point A to point B and thereby remove all the abusive pricing. What we at times fail to recognize is that in the US, because we have not adequately invested in community health systems, people don't have access to the basic clinics and preventive care resources that they need to reduce the likelihood of diabetes, to reduce the likelihood of heart disease. And by not addressing that, the cost associated with people having just to manage their daily heart disease, diabetes, is predisposing us not only to higher costs out of our pockets today, but it makes it very hard to understand how a single payer system would be feasible in the US. And that's why I believe that in Rhode Island, we should pilot a comprehensive free community health system accessible in different forms to our rural communities in South County, as well as our urban communities in Providence County and beyond. Because if we can demonstrate that we have the infrastructure for people to have clinics in walking distance that are accessible, then perhaps we could not only reduce the incidence of chronic diseases like diabetes, heart disease, but better serve those individuals that do have those diseases and that need resources that they currently can't necessarily afford. Now, by taking that step, I think we can start to look globally and say, if it's working for Japan and Israel in terms of their governments taking more control of how that dollar gets from point A to point B, why can't we?
Well, you've had other candidates in the past who have talked a lot about going to a single payer system. One thing that comes to mind, of course, is we had the Affordable Care Act, which was supposed to reduce costs and make health care insurance available to everyone. Doesn't seem to have achieved either of those goals. And the other thing is, a single payer system, seems to me what you're doing is swapping one bureaucracy, that is the insurance intermediary, with another, which should be a government agency. So thousands of people will be put out of work in the private healthcare insurance companies. In exchange, we're going to increase the government bureaucracy that's going to have to do the same job they're doing. So the savings that you say will accrue doesn't seem to flow naturally from going to a single payer system.
So Medicare for All, the Bernie Sanders version of a national single payer system, has not been programmatically outlined in terms of how they would address its implementation, but also addressing some of the Medicare gaps that exist too in terms of coverage. We were talking about that with ophthalmology in particular. But state-based single payers, the proposal is very different from a federally run Medicare for All. A state piloting a state-run single payer system was most evident in Vermont's program back in 2014. And I would say that one of the failures of Vermont's system is that they did not adequately invest in community health infrastructure. They assumed that the payment system alone would address the problems in delivery. What I am saying is the problems in delivery are a consequence of not having adequate community health infrastructure. If we have the infrastructure, again, free clinics that are in walkable distance to all communities, rural and urban, then the payment system will supplement that. And in terms of intermediary organizations, I can pose a very easy example here. You look at pharmacy benefits management companies that are between pharmacies and manufacturers, or group purchasing organizations that are in between hospitals and manufacturers. Those middle organizations are negotiating price points for products and to some degree, contributing to prices of services. Those negotiations are always manipulated by those middle parties, and it is for the interest of profit, not people. So I would always stand on the side of saying that a government run by the people is more likely to do right by the people than a for-profit business that has a fiduciary responsibility to its stakeholders.
I'd like to move on to some other topics. I think we could do a whole show on this whole healthcare, health insurance topic, and maybe you'll be able to come back and we'll be able to do that as the campaign unfolds. Yeah. In response to a question from my colleague, Mike Stenhouse, back at your last interview, you described your political philosophy as a pragmatist who makes fact-based decisions. Looking at your website this time around, one could conclude that you've really joined the progressive socialist wing of the Democrat Party. Is that true?
So do I believe in socialized institutions like healthcare? I've always believed that.
Well,
I take the Hippocratic
oath. Other
oath.
than healthcare.
Well, I just want to be clear. I take the Hippocratic oath, so that's what I believe. In terms of believing that a migration from a capitalist form of government to a socialist form of government will solve the problem of oligarchy, I don't think that'll solve the problem. Power dynamics do not change with different structures of government. We've seen that historically. I am of the belief that this country, we are seeing a disparity that is unjustifiable on moral grounds between the rich and poor. We continue to see disparities in educational outcomes that disproportionately affect racialized communities. And while there's a lot of talk of this word equity, very little politicians in this country understand what equity means or are making the investments to address outcomes that may never be purely equal, but at least the disparity and the variance between those outcomes will not be as disproportionate. And my stance on issues today has been no different than my stance on issues previously. What I will say, though, is it is progress. It is progress. Now, corporate progressives per se that like to throw ideas out without having an implementation plan, that is dangerous for vulnerable communities. If we jump into a single payer system and do not have community health infrastructure and that system collapses, it will collapse on the poor. And so I continue to be pragmatic in terms of needing an implementation path that works and is sustainable.
Your website, and you use the words equity and justice a lot, which seems to be a standard lexicon in the progressive movement. Explain exactly what you mean when you use those terms, equity and justice. What do you mean? Yeah,
I believe that equity, again, is a lens. It starts with a lens, then a sequence of events. The lens is, do we observe the unequal outcomes? And at what point is there a threshold that's exceeded that we say the disparity between those outcomes is so significant that we are doing something wrong? That inequity is a result of our actions, even if those actions were historical, not our own. And so equity is a lens, but we have to have actionable steps based on the observations that we make. And even though equity has come to the forefront of the discussion in terms of understanding what we're seeing, very little in terms of proactive steps are being taken to address the root cause of poverty. And so in the sequence of events that leaders take, we can even point out the current governor. Are they taking steps to address the inequities? One example was the vaccine equity gap that we were seeing. The Rhode Island Department of Health, I'm on the state's Equity Council, was providing data to show that racialized communities, Black, Indigenous, Asian, and Latino communities were not receiving vaccines at not only the same rate, but that there was a significant gap in those that were vaccinated and those that weren't. And the separation was by racialized group. When Governor McKee stepped into office, my judgment had been on the Raymond administration for not taking steps earlier. My hope was that the current administration would take a step to mobilize the National Guard to address the vaccine equity gap. Instead, the current governor, in responding to dynamics of power brokers, decided to vaccinate 18,000 teachers before vaccinating any Black, Indigenous, Asian, or Latino communities that were at higher risk for hospitalization or death. So it wasn't enough that he had the lens, that he had the Rhode Island Department of Health pointing out the inequities. There have to be actionable steps that in the sequence of events address the greatest need and the most vulnerable communities. And we did that to start in terms of our elders, but we did not follow on to address that gap in racialized communities.
I'm going to throw you another hot potato because as we are taping this today on June 28th, the House of Representatives is voting on a very contentious issue this time around. When you were interviewed in March of 2018, you said you were a supporter of the Second Amendment. In the light of the increase of gang and drug-related gun violence in Providence, where do you stand on what the anti-gun community calls common sense solutions? Where do you stand on those?
Yeah, so being in support of the Second Amendment, understanding that a governor would not be able to change the Constitution in any way, does not mean that we do not need more mental health screenings, which are not happening. In addressing, weapons, especially those that can be modified in ways to make them more dangerous. People argue, oh, what is a military-style weapon? What is a semi-automatic? What is automatic? Automatics are already banned, et cetera. We can get into that discussion for an hour. I mean, my father has been a hunter for years. But the key from my perspective is, if all it takes is a 3D printed accessory to make an already more dangerous weapon even more dangerous, then is it a weapon that we should make as easily accessible? I also believe we should have a traceback program. I don't think we do enough to track the origin of a weapon back to the original owner. Because I believe that even the violence we're seeing in the urban core, if we actually had a program that was looking at who initially owned that weapon and we held them accountable with civil suits, we would start to see that it is not people from that community who are the original owners.
So you say civil suits, so you're talking about a citizen whose firearm is stolen, who would be civilly responsible if that gun is subsequently used in a crime?
Well, why do we assume that they reported it stolen? And that's the problem. There's so many weapons in the street, and without actually having a traceback program, we're making the assumption that every single one of those weapons was reported stolen.
Well, I'm not making that assumption.
Not you, but like in general,
no,
as a society.
President Biden, when he announced his initiative involving an ATF task force and so forth, made the statement that only 5% of the gun dealers who are responsible for 90% of the guns that find their way into criminal use. So the question is, why don't they take away the licenses of those 5% of the guns that are used? In other words, if 90% are from 5% of the dealers, that means only 10% are coming from other sources, which might in fact be guns that are stolen. So,
well, what about gun shows too? I mean,
pardon?
why not hold the gun show, trade show owners that run the booths that sell 82 guns to a single person, or sold one to a 14-year-old, which came out on CNN the other day? Why don't we hold them accountable too? Because
the gun show loophole is actually a fiction. And if you go to a gun show, you are run through a background check, federal background check, every time, if you're dealing with a legitimate dealer. If you go out to the parking lot and find some guy out there selling guns out of the back of his van, he's already doing it illegally.
But the question is, and this is the connecting the dots, for the guns that end up on the street that are involved in violent crimes, are we doing enough to trace it back to the person that initially owned and or sold the gun? We're not currently doing enough.
Well, okay. I don't want to just tie up the rest of the show on that problem. I want to ask you about something else that seems to be a hot issue. Should immigrants here illegally be issued Rhode Island driver's licenses, and if so, why?
So people who do not have the status of resident should absolutely be given driver's license. We talk about, and let's talk about history here. We had olive skin colored Sicilians come to this country, and in their own country were facing inequities as a result even of variations in skin tone. They come to this country, they serve in World War II. Their families are still considered enemies of the state even years after they serve in World War II. And what does Rhode Island do? Federal Hill House and other organizations, and I was talking to John Carlovali about this, they create centers that support the community and allow them to go through the residency application process, right? And to some extent, the word used then was assimilation. I would not use that word now because I think there's culture lost at times with assimilation. But my point is, we have access issues in this country with people that have been born in this country not being able to get to universities, not being able to get to jobs as a result of transportation. There's all this talk about people going through the path, lifting themselves up by the bootstrap. We did it, our parents did it, why can't they wait their turn? And all of that said, and we don't, as a state, even want to give them driver's licenses to get to the job, to get to the university?
First of all, we're talking about people who are here illegally. Either they came in illegally through the border or they're overstayed their visa. They're not supposed to be working unless they're here on a work visa. And I remember Governor Link Chafee saying, oh, they needed to get to their work. But many people on the liberal bent were often saying that, listen, they should fine and penalize these employers that are hiring these people.
Well, look, there were Italian families that were here and did not have.
I'm not talking about Italians.
No, but I'm talking about the history of Rhode Island, though. Let's not forget the history that we have in this state of supporting Italian communities that did not have documentation. We supported those communities. We can support the Latino community and the African community and our Southeast Asian communities like Cambodians that still have refugee status. We can provide licenses. I will say this, and I want all the listeners to know, I believe that we should end contracts between ICE and private prisons. I believe that we should give licenses. I believe that we should actually make assistance programs like health, housing, food easily accessible by families that are here because they're human beings. And we live in a country that preaches morality, a country that is very wealthy. And if we don't stand the same ground we stood in the 70s and the 60s when we were supporting other communities, now with the communities that are migrating to this country, then what does that say about the future of America? Is it going to be the country of promise? I believe it still is.
Okay. Well, we have maybe a minute and a half left, so I'm going to ask you to summarize why Democrats should vote for you in the primary.
Yeah, I guess I'll look at the camera when I do this. Yeah. Well, thank you all for giving me this opportunity. Again, my name is Luis Daniel Munoz. I'm a medical doctor, organizer. I grew up in Central Falls. I experienced struggle. I understand what it is to be hungry, to see loved ones entrapped in cycles of poverty and addiction. And it's that personal struggle when teamed with my professional perspective that has led me to believe that we can do better. Institutionally, we can transform healthcare in a way that's more accessible to all Rhode Islanders. In terms of economics, we can better support our local economies. We can redirect Commerce Rhode Island in ways that could support the micro businesses in the state that ultimately keep our economies up. We can have livable wages, even if the first step is using federal dollars to create minimum wage supplemental programs for all adults that are willing to participate in the Rhode Island Promise program. But to do that, we have to expand Rhode Island Promise. We have to take bold steps that truly reflect not only the safety nets that embody our humanity and our morality, but the springing up of people to push them out of cycles of poverty. And that's not just a metaphor. That is a programmatic path that we can take by connecting dots that have been established. But if we leave them fragmented, we're going to continue to see the same outcomes. So when you vote in the Democratic primary, please know that the 6 names on that list, Luis Daniel Munoz is the one fighting for you.
Well, we certainly have enjoyed your appearance, and I hope you'll come back as the campaign unfolds. And I will make a promise to you that you will be invited to a debate as long as there's not 5 or 6 candidates, because we certainly can't do that in a half hour or even an hour format. But we would certainly like to have you back. There's many other questions and topics that we need to discuss, and we want to wish you the very best in your campaign this time around.
Thank you so much.